Good evening, Windsor. This is Angie with our evening update on COVID-19 and related topics. It is Friday, March 27th. Just to give you a general update on the COVID-19 pandemic here in the state of Florida. As of noon today, we are at 2,900 cases even, with 53 confirmed cases in Osceola County, 156 cases in Orange County, with continued growth in our surrounding areas. Just to provide a little bit more information in terms of what's happening in Florida, of those 2,900 cases, we have seen 456 hospitalizations with 34 deaths. The Department of Health is doing a pretty good job trying to keep track of information and data related to the many cases of COVID-19 they're seeing. I wanted to take a look, and it's a little bit morbid, but I wanted to take a look at the death statistics in relation to age and other comorbidities, because I feel it's necessary to really communicate effectively with residents and families why we are taking such extreme measures to protect the health and safety of the community. And that is, of the 34 deaths that are recorded in the state of Florida at this time, directly correlated to COVID-19, there is information available on 29 of them. Of those 29 deaths, 28 individuals are age 65 and older. Okay, and I think the one person that is not 65 or older was, I believe, in the neighborhood of 52. So again, while the average age of individuals, I believe, in the state of Florida is probably around 47 to 49 is what I'm seeing as far as average age. The average age of mortality is much, much higher. So again, this is the reason why we are being so diligent and so proactive in our efforts to keep the COVID-19 infection out of our community, or worst case scenario, should it come into the community, that we are working so hard to try to contain the virus within areas of the community and not allow it to spread. So that's the update on Florida. As a country, we unfortunately have taken the #1 position for COVID-19 cases, and I am going to tell you we are currently at 100,717 cases of the 590,000 plus cases in the world. So unfortunately, the United States is growing pretty rapidly, and Florida is certainly a contributor to that as well. So this continues to be something that is very real and very much a threat to the state of Florida, our community, and us as individuals. So we will continue with our efforts to preserve the health and safety of the community through our aggressive strategy and tactics. Okay, so let's get a little bit more into just the daily updates, if you will. As we've talked about before, we are seeing a pretty significant shortage in personal protective equipment, as well as cleaning supplies and disinfectants, as well as hand soap and sanitizers. Right now, we are in pretty good position, but we are trying to be mindful to preserve the supply that we do have, knowing that it is going to become more difficult to get those supplies refilled. As an example, we have observed a number of different individuals utilizing the touchless hand sanitizer. We have those in, I think, 4 different locations in the community. I'm here to tell you, 1 squirt is all you need, okay? 1 squirt of hand sanitizer is plenty to rub the hands, get up the elbows, okay? Okay, so really get it in there good. I can speak from experience. 1 squirt will do it. So please be mindful of that. We've seen people with the squirt trio, which is a little excessive. We don't need that much. So please, 1 squirt will help us preserve the supply we have for a longer period of time for more individuals to use. So thank you in advance for that. Okay, now, realizing that we have been doing so many to-go meals and boxed meals, that a lot of people have leftovers, or maybe you don't eat them right away, so food is going into the refrigerator, food is sitting on the counter, etc. Please be mindful. We did publish a document that went through heating and cooling instructions for those containers and that food. Please refer to that if you're heating food or if you're storing food. We are going to have the staff working more diligently just to make sure that there isn't boxed food, etc., stacking up in the community. Our goal is to be to pull out the trash from the prior meal with each delivery, particularly in the village residences. So please help us with that. Feel free to call the concierge if you need an additional trash removal, etc. We want to help keep your apartments clean and as clean as we can during this time. Okay. As you know, we talked yesterday about the stay-at-home orders that were issued in both Osceola and Orange counties. Those orders went into effect last evening, March 25th at 11 p.m. and again are going to remain in effect until at least 11 p.m. on April 9th. With that said, I have to reiterate that residents and staff really can only be outside of the home or the workplace for reasons that are deemed essential. Okay, so medically necessary appointments, essential. Elective, annual, proactive health screening appointments might not fit that criteria. We encourage you to speak with your family, speak with Linda, our wellness navigator, speak with Ali, our director of health services, and talk about, is this appointment something that needs to happen, or is this appointment something that can be rescheduled? Also, I had some very good advice by a resident this morning who said, Angie, I was calling because I didn't think it was the right idea to go to my appointment. I called them and they actually said that they were willing to do my visit via conference call. And so give a call to your doctor's office. They might be able to accomplish that appointment in another way, whether it's a telehealth video, a conference call, etc. So give a call and ask your doctor if there are any alternatives to coming into the office. Okay. Additionally, we are trying to get residents to stop going out for other reasons that might be acceptable under the stay-at-home rule, like the grocery store, the pharmacy, because we can help you accomplish those things here. Again, the less you're leaving the community, the less likely we are to have the coronavirus come into the community and affect others. Okay? So we have Turner Drugs and Guardian Pharmacy that can deliver to you. We also are creating our in-house grocery program, which is wonderful. I have the list here. We've got a pretty good list of groceries that you'll be able to order at home. I'm working on getting those final changes made, and we are going to get those order sheets out this weekend. Then we'll pick them up on Monday. There'll be more details to come, and deliveries will be made on Tuesday. All purchases for residents can go to their house accounts, and we'll be managing the staff program as well. So again, please try to use the internal grocery program in lieu of going out to the grocery store. If there's anything you're not able to get through the internal grocery program, let's look at alternatives, okay, aside from going out to the grocery store. Okay, so we're excited about kicking that program off. We've got a really good list of things. We think it's going to cover a lot of bases, and I won't say most importantly, but very importantly, the list also contains paper goods, so toilet paper, paper towels, facial tissue, etc. Okay, let's see. One of the things that we noticed today in some of the deliveries that are coming into the community, it's a little bit concerning, is that it appears that sometimes boxes are getting to us opened, okay? Please, please, please check the contents of your boxes when you receive them. Today it was some medical products for a resident. Glenn brought them to me. I went through the box. I actually looked at the inventory sheet and everything was there, but it was a little bit peculiar that it was open, and it did appear that it was sliced and opened, not accidentally opened. So please take a look and make sure that the inventory that's supposed to be in the package you've received is there. We we're really concerned about that. And in such an unusual situation, unfortunately, we don't know what's going to happen, how people are going to behave, etc. If this is going to be something we're going to see in increased numbers, or this was just a fluke. But again, just want to remind you or tell you we're not opening packages. If they come to you open, they came to us that way, please check and make sure that your inventory is complete. If it's not, please contact the sender. Okay. Let's see. I think that is about it for the evening. We have a relatively full house this weekend of directors and some other line staff that have elected to move into the community because they feel safer here. We are so happy to provide some of our employees a safe haven where they feel that they are better able to serve the community and potentially keep their family safe at home, not going back and forth, myself, of course, being one. That said, there will be a lot of coverage this weekend. There will also be, Mark will be here tomorrow as the manager on duty, but of course, Glenn, Cece, myself, Chef Jorge, and a number of other individuals will be around as well. So if you need anything, there should be plenty of folks to help you. Don't hesitate the concierge and ask for the manager on duty. Sunday, there will be multiple of us working and around the community. So again, just please call the concierge for assistance if you need it. I think that is about it. We wish everybody a healthy and happy weekend. I'm just going to real quickly before we get off, check and see if the numbers have been updated. And they have not. So what I mentioned earlier is still what stands. Please be safe. Please be thoughtful. Remember, this pandemic is one that can only be solved through the efforts of the collective society. I know each and every one of us have needs, desires, wishes, etc. But we all are making sacrifices at this time. And that is why it is so important that even though you might want to go out or you might want to do something that at this time falls within our restricted activity, that it might not, you might not think it's a big deal because it's not affecting you, you're just one person. But we have to think about the ripple and how our actions and the things that we do, how those things potentially affect others, okay? That being, I just went out to the store, or my son ran into the store, or whatever it may be. You then are in contact with that person, and you then potentially bring it back to the community. One other thing I want to mention is this came up today. We did have a resident go out and, response to Nurse Linda when she came back in and got screened was, but I don't have a fever. I'm not infectious. Everything's fine. Please be mindful that symptoms do not appear immediately, okay? It can take 2 to 9 days for symptoms to appear. Okay, so just because you go to the store and come back 20 minutes later and you don't have a temperature, that doesn't mean we're safe from the COVID-19 virus. It is a sneaky thing and takes its time and sometimes doesn't even show its face at all. We could be walking around and be transmitting or shedding virus to others, and we just don't know it. So we have to be very mindful and considerate of the impact that we have on others. I might choose to go to the store and that should be fine, except it's not, because you then come into the community and have the possible impact on others. And that's where community living, we need to be a little bit more mindful of that. So anyway, that is about it. I hope everybody who had a quarantini enjoyed it. And we look forward to seeing and hearing from you this weekend. Families, please continue to send in pictures, videos, etc. We've had so much fun getting to see what's coming in. I think we're getting pretty darn close to having enough materials to be able to deliver a special handmade art card Easter egg duck, which my family sent. My nieces and nephews sent from New Jersey during their kind of homeschool adventures. So lots of fun to come as we move forward, and we're just going to keep taking it one day at a time and keep doing the best we can. So thank you to each and every one of you. We appreciate you. And we look forward to getting beyond this and getting back to life as we know it. So have a wonderful weekend. Thanks, everyone.